So we'll be continuing with coronary artery disease, moving on to the surgical management. Now the surgical management that I'm going to discuss will be the same in angina pectoris, and it will be also same in myocardial infarction and same in many other cardiac disorders. I will not be repeating it, okay? So I'm dealing now in detail regarding the surgical management. That will be the same for most of the other cardiac disorders, okay? So now the surgical management that I will be discussing is very quite interesting, okay? And on in the exam point of view, PTCA, it will be asked for 2 marks or for 5 marks. And they may ask regarding preoperative or postoperative preparation of open heart surgery or CABG surgery. Okay, other than that, they have not asked particularly what is the surgery and all, but the other things may be asked. But PTCA is normally asked. Okay, it is very important. You need to draw the diagram as well. Okay. So moving on to the surgical management of coronary artery disease, we have got percutaneous coronary intervention. Okay, it is also referred as PTCA. I'll let you know why I have written here PCI. Okay, percutaneous coronary intervention. Next surgery that we do is coronary artery bypass graft. Okay, now the CABG surgery that I am discussing is the traditional CABG surgery as well as mid cap, op cap, TMLR. TMLR I'll be discussing in detail in angina pectoris, okay, and even laser ablation I'll be discussing in angina pectoris, okay. Then after that comes as atherectomy, embolectomy, thrombectomy, and end arterectomy, okay. So we'll see this end arterectomy or atherectomy is one and the same, okay. We'll see regarding all of the surgeries in detail. So first of all, moving on to percutaneous coronary intervention. The word meaning of percutaneous means through the unbroken skin, and PCI, it includes PTCA with or without stent placement. Okay, as I continue with my explanation, you will come to know what is a stent and all. Okay, so percutaneous coronary intervention, it includes PTCA with or without using the stent. Okay, now the word meaning of PTCA is, most of the people get confused with the full forms. Okay, you will not even remember the full form of the surgeries here. Okay, so PTCA refers to percutaneous transluminal coronary angioplasty. So please note down here, this is angioplasty, not angiogram. Okay, angiogram I have discussed in cardiac catheterization. Okay, so cardiac catheterization I discussed angiogram. That was a diagnostic procedure to detect or to diagnose the place where exactly there is blockage in the coronary artery, while PTCA, that is angioplasty, is a surgical procedure to treat the condition. Okay, so that is why don't get confused. I have seen many of them telling it is percutaneous transluminal coronary angiogram. It's not angiogram, it's angioplasty. Okay, so I'll just use the term angioplasty or PTCA. Okay, now this PCI, as I told, it is PTCA with or without using the stent. Okay, so this is the stent picture that is actually used. Okay, and I'll let you know what is exactly done in the procedure. Now what they usually do is, I have already explained regarding the cardiac catheterization or cardiac angiogram, isn't it? In cardiac angiogram, what they have done, they are inserting a catheter through the radial, through the brachial, or through the femoral artery, isn't it? And then it is going to the heart. Once it reaches the heart, they were injecting a radio-opaque dye, isn't it? They were injecting a radio-opaque dye so that you will get a clear visualization of the coronary artery, so that you can detect where is the blockage in which coronary artery, whether it is in the right or the left branches of coronary artery. Now, the procedure of coronary angioplasty or PTCA remains the same. What they do here is, they are inserting a balloon tipped catheter. Only difference is they are inserting a balloon tipped catheter. Okay, so the balloon tipped catheter can be inserted again through any of the route, through the radial, femoral, or even the brachial. But commonly the cardiologist may decide on the site depending upon the patient's convenience, or it also depends on the surgeon's preference. Okay, now if they have selected a femoral route, what they will do, the balloon tipped catheter will be inserted through the femoral route. Initially same procedure is done. What they will do, they will clean the site, okay, they will give local anesthetic agent, and then they are going to insert a needle, isn't it, and then they will insert the balloon tipped catheter. So the balloon tipped catheter will move into the heart. Okay, so once it has reached the heart and once it has reached the blockage, okay, so before doing angioplasty only they will do the angiogram. Okay, they will do the angiogram and they will find out where is the exact place of blockage. Or sometimes while doing angiogram only they can do angioplasty also, but we need to take consent from the patient party prior to that. Okay, so remember that. So they will detect where is the blockage. So once the balloon tipped catheter has reached the point of blockage, okay, what they will do, they will inflate the balloon. Okay, so what they will do, once it has reached the point of blockage, the balloon will be inflated and it will be deflated continuously. Why it is done? So that it will compress the atheroma or the plaque. Okay, so as the catheter reaches the heart and once it reaches the place of obstruction, okay, where there is atheroma or plaque, what will be done? The balloon tipped catheter will be inflated and deflated so that it will compress the atheroma or the plaque. Okay, so once the atheroma or plaque is compressed, what they will do? They will deflate the balloon and they will remove the balloon tipped catheter. Then remaining will be aftercare is the same. You know what they will do in cardiac catheterization, isn't it? They are going to remove the catheter and then they will keep the pressure for at least 10-15 minutes. Then they have to monitor for bleeding. Then remaining care is the same. Okay, so that is regarding balloon angioplasty or coronary angioplasty. Now stent is little bit different. I will tell you in the coming slides. Okay, so this is the exact procedure of PTCA you are supposed to write for the exam and with the diagram. Okay, I will let you know which diagram you are supposed to draw. So here also I have explained the same thing. You can go through the picture here. You need not write it down. Okay, this picture you need not write it down. So the definition of PTCA, I'll repeat it again. PTCA is done to open the blocked or the narrowed coronary artery. Okay, why? Because of atheroma or plaque deposition which is there. On that region you are using the balloon angioplasty. Okay, why you are doing it? To restore the blood flow to the heart. And you should always remember PTCA is done, okay, so that you will not go for an open heart surgery. Now open heart surgery, when you do, you have to give a bigger incision, you have to do thoracotomy, you have to open up the thorax, isn't it? And it is a more invasive procedure when compared to PTCA. Okay, so remember PTCA is done initially. Okay, it is less invasive when compared to the open heart surgery. Okay, so PTCA is used to open the blocked coronary artery and to restore the blood flow. So as I told, what they are doing here, once the balloon tipped catheter reaches the place of obstruction, that is where there is atheroma or plaque, what will happen? What they will do? They will inflate the balloon. Okay, as you can see here, when they are inflating the balloon and deflating it continuously, it will flatten the plaque deposition. Okay, so once the coronary arteries, this plaque is flattened, what they will do? They will deflate the balloon and they will remove it. That's all. So that the blood flow will be improved. Okay. So this is the place where angioplasty is done. Now angiogram and angioplasty is done in the same cath lab. Okay, with the help of fluoroscopy. Fluoroscopy is the same TV like monitor which I have told in cardiac catheterization. You can visualize in that fluoroscopy, like where you have reached where is the place of obstruction, where is the balloon tipped catheter, whether it is inflated or whether it is deflated. Everything can be seen in the fluoroscopy machine. Okay, this is the same procedure that I have explained. Balloon tipped catheter is inserted either through the femoral, brachial or radial artery. Once it reaches the place of narrowing where there is atheroma, the balloon will be inflated and deflated continuously till the fat or till the atheroma is flattened. And once the artery is reshaped, it has become normal. What they will do, they will deflate the balloon and remove it. Okay, so we'll see some features of PTCA. It is a less invasive procedure and less expensive when compared to open heart surgery, because this PTCA procedure, if we are using the stent, okay, if we are using the stent, usually it can range from around 15,000 to 30,000. Okay, if we use a stent, I'm telling. Okay, but your CABG surgeries, you know, it will cost from around 1 to 5 lakhs, isn't it? So this is quite cheaper and less invasive, because in open heart surgery, you are giving an open incision to the thorax. And one more feature is the entire procedure, as I have told, is visualized under the fluoroscopy, okay, under X-ray guidance, as it is shown in this figure. So again, this is a cath lab. Here you can see patient will be lying down here. This is the fluoroscopy which I was speaking of. Okay, you can visualize it very clearly, and the entire procedure is done in the cath lab. Now next, I was telling you can use a stent or may not be using a stent in PTCA. Okay, so when PTCA is asked for exam, you have to explain about the balloon angioplasty and you should also explain about the stent. Okay, now here you can see in the figure that is a stent. Okay, so originally why we are using stent is sometimes chances are there that once you have done balloon angioplasty in that region only, again there can be a blockage. Okay, so again there can be blockage, there can be chances of recurrency. So to prevent that, we are using the stents. Okay, so where there is a region of blockage, there only you are using the stent. Okay, so procedure is the same. I'll explain it to you. Okay, so it was originally designed to reduce the restenosis and closure of the coronary vessels. Okay, that is resulting from angioplasty, balloon angioplasty. Okay, so to prevent the recurrence, we are using the stent. Now, stent is actually a very tiny expandable mesh-like device. Here you can see. Okay, here also you can see it's very tiny. Okay, very tiny. So it is a tiny expandable mesh-like device, and it is usually made up of stainless steel or cobalt alloy or platinum alloy. It depends. Okay, now the cost will also depend on the type of the stent that you are going to use. Okay, so these stents, which are tiny and expandable, they will be used in the region where there is narrowing or where there is atheroma. That place you will be using the stent. Okay, and nowadays we have also got bioabsorbable material, but commonly stents are made up of stainless steel, platinum or even cobalt alloy or even nickel. Okay, so this is a figure that you are supposed to draw in your notebook and even for the exam. So I'll tell you the procedure of this stent placement. It is same thing. A balloon tipped catheter with the stent will be inserted. Okay, it will be inserted through the femoral, radial or through the brachial artery. Okay, and once it reaches the place of obstruction where there is atheroma, once it reaches the place of atheroma or plaque, the balloon will be inflated. Okay, the balloon will be inflated. So when they are inflating the balloon, the stent will become, I told it is expandable, isn't it? So stent will remain in the place of atheroma. Okay, and then they may inflate and deflate it 2-3 times and stent will remain in place. And then what they will do, they will remove the balloon tipped catheter, but the stent will remain there permanently. It will remain there permanently. Now you should always think that a stainless steel material that is used, that is remaining inside your body, is like a foreign material, isn't it? What will happen when you are keeping a stainless steel like material in your blood vessel? What can happen? It is actually a thrombogenic agent, isn't it? So a lot of blood clots can get attached to it, and that itself may result in what? Thrombus formation. So to prevent that, a patient who is having a stent has to take lifelong antiplatelets. Okay, lifelong they have to take antiplatelets like aspirin or clopidogrel. You know, when lifelong they have to take medications like aspirin, what they have to do? They have to monitor the drug levels of aspirin every now and then. They should also monitor the prothrombin count, bleeding time or clotting time, isn't it? Why you have to monitor all that? Because continuously when the patient is on aspirin, chances of bleeding is high. Okay, so risk of this antiplatelet drugs is they may prevent clotting, but they can result in bleeding. Okay, so remember that that is the only one problem with the stents. Okay, remaining procedure is the same thing. So here also we have got the same figure. So again, this is a procedure that has been explained in the slide, which I have already told. So once the coronary lesion has been identified, what they will do, the balloon tipped catheter, which is having the stent, will be inserted into the coronary artery. Once it reaches the place of obstruction, the balloon will be inflated. So because of that, the stent will be expanded and it will stay in the region of obstruction. Then the balloon tipped catheter is deflated and removed, but the stent will remain in the place of atheroma permanently. Okay. And then what I told, because it remains permanently inside, the patient will be given some antiplatelet drugs like aspirin or clopidogrel. Lifelong they have to take. Okay. Now, certain other things, as I was telling about the cost, most of the time the cost of this stent, okay, it can range, it depends on the range, and the entire PTCA procedure may take around 20,000 to 30,000. If a person is under some government schemes and all, it may range lesser, okay, 10,000, 15,000 and all under the government schemes. And the entire procedure of PTCA, it is little more costly. Okay, the stents are around 20,000 to 30,000. It may range, or 10 to 15,000. The entire procedure may take around 1 lakh or around 90,000 also it can take. Okay. Now, next is risk of PTCA. Some few risks are there, like it can result in bleeding at the region where you have inserted, maybe in the femoral or the radial or brachial region. Next is blood clots can result. It may also result in infection. Sometimes arrhythmias can happen when you're inserting the catheter. Some patients may experience chest pain or discomfort, and if forcefully if you are doing the procedure, sometimes it may result in rupture of coronary artery. Okay, so these risks are similar to that of your cardiac catheterization or coronary angiogram. Okay. Now next is moving on to the open heart surgery, that is CABG. CABG full form is coronary artery bypass grafting. Okay. Now why the word bypass is used? Because you are using the veins or you are using the arteries from some other place of your body, okay, as bypass, because there is already blockage in your heart. Okay, so maybe there is blockage in the coronary arteries. So what you will do, you are using the bypass, that is, you will take veins or arteries from some other place and you are placing it in the region of blockage. Okay. Now the bypass is usually placed beyond the blockage, not exactly on the region of blockage only. Okay. They will place it beyond the region of the blockage so that it is useful for future, and again there may not be any obstruction. Okay. And you should always know that before doing this open heart surgery or CABG surgery, angiogram will be done. Angiogram will be done, and only when 2 or more coronary arteries are blocked, in that case only they will go for this CABG surgery. Okay. Otherwise, if only one vessel is involved, they may always go for balloon angioplasty. Okay. So here you can see this is maybe the region of blockage. Okay, you can see that the region of blockage is here. Here one blockage is there. Here one blockage is there. And they have used grafts in some other place, isn't it? So the grafts, maybe they will take veins or arteries from different sites. We'll discuss from where and all they are going to take it. Okay. So first we will see the definition of CABG surgery. CABG is a form of bypass surgery that can create new route around the blocked coronary arteries, which allows increased blood flow, oxygenation and nutrients to the heart muscle. So remember, it is a bypass surgery. Why it is a bypass surgery? Already I told, because You're taking veins and artery from some other sites of your own body here, okay, where there is narrowing or blockage in the coronary artery. And earlier the CABG surgery was very rare, but nowadays CABG surgeries are the most common type of major surgeries. So here also you can see they have taken the vein and they have created a new bypass. Okay. What is the purpose of CABG surgery? The first main purpose is to restore the blood flow. It will prevent complications like if there is permanently 2, 3 or more of the coronary arteries are involved and more blockage is there, patient can go into heart attack or myocardial infarction or some other problems may happen. So it will prevent complications also by restoring the blood flow. And next is it will improve the quality of life. Patient will not experience angina like pain or ischemia and all. And as I told, it will lower the risk of heart attack. And most of the time the CABG surgeries are used when there is a failed PTCA procedure. Okay, when balloon angioplasty was used, even after that there is no flattening of atherosclerosis, then you can go for CABG surgery. And one more, we use it in triple vessel disease. Now, triple vessel disease is a severe form where three of the coronary arteries are being blocked or three of the coronary arteries are being obstructed. In that case, we cannot do in each part, we cannot go for balloon angioplasty. So, they will go for this CABG surgery. Okay. Now, contraindications of the open heart surgery is you will not do it on a pregnant woman or when they are having uncontrolled arrhythmias. Okay, suddenly when you are doing the surgery and all, arrhythmias can happen, or after the surgery arrhythmias can happen. So, we will not do on patients who have uncontrolled arrhythmias. One more is patients who are with cardiomyopathy may not be able to tolerate the surgery. Okay, so it is not done on the such patients. Next is if the blood pressure is uncontrolled, they are not able to control the blood pressure, we will wait for the BP to become normal. Okay, then only they will perform the CABG surgery. Now, how will you prepare the patient for CABG surgery? First of all, since it is a major surgery, lot of procedures are to be done before the surgery. First of all, you have to collect a thorough history from the patient. Ask them if they have got any drug allergies or they have undergone any prior surgeries, they are having any prior medical illnesses like diabetes mellitus or hypertension. Okay, whether they have history of smoking, what other habits they are having, that all they have to quit before this major surgery. It is very, very essential. Okay, and next is a thorough physical assessment will be done of entire body system from head to foot. They will do a thorough physical examination to see if they have got any other problems. Next is diagnostic procedures will be carried out. Okay, like all the diagnostic procedures they will do. Blood investigations, you know, they have to do to check for HIV or hepatitis B. Other than that, they will do an ECG, echocardiogram, chest X-ray. Okay, everything will be done. Even angiogram will be done prior to the procedure. Okay, because we should know what other abnormalities they are having. And most of the time, they will also monitor their liver function test, renal function test, blood sugars, cholesterol levels. Next is before the procedure, you know, these all preparations are done. One is psychological preparation. You have to relieve the anxiety of the patient, isn't it? What you will do is you have to explain the procedure to the patient, okay, to relieve the anxiety. Tell them the risk that is involved with the surgery. That is usually done by the surgeon. Next is financial preparation. Now, CABG surgery is costly. Okay, it will range from 1 lakh to 4 lakhs or 5 lakhs, more than that also, depending upon the condition of the patient. Okay, so they have to financially get prepared. So tell them or explain to them. Next is take consent. It is a major surgery. The patient's party as well as the patient has to agree for the surgery. So take the consent and explain them regarding the complications or the risk of the surgery. Next is physical preparation. You are doing the surgery on the chest region. So maybe if there is lot of hair, you need to trim the hair. Okay. Spiritual preparation. Again, the patient is very scared, anxious. Let them follow their own spiritual practices. Next is physiological preparation. You know, entire prior to the procedure, during and after the procedure, you have to monitor the vital signs, ECG. Then tell the patient to avoid smoking at least 2 to 3 months prior to the procedure. and withholding aspirin. Why you have to withhold aspirin? Because continuous intake of aspirin may result in bleeding, excessive bleeding. Next is immediate preparation, that you are aware what and all they have to do. Put on the gown, you have to cut short the nails of the patient, isn't it? Prior to the procedure, you have to give an enema, keep the patient NPO from 12 midnight, okay? And maybe the patient has to be catheterized, urinary catheter has to be inserted. Those all things will be done immediately before the surgery. Okay. Next is types. Now op cab and mid cab I have included under this only. Okay. It is a separate surgery. Please remember, it's a separate surgery. Okay. Now the traditional CABG, this is how you are doing the surgery. You can see the patient is here and you can see the condition, isn't it? This is what exactly that you see in a cardiac OT. Okay. So I'll explain to you the procedure of the CABG procedure. Okay. So first the patient will be kept in the operating room. Okay. And then the anesthetist will put the IV catheter. Okay. Sorry, the IV cannula will be put and arterial line may be put. They will inject or they will give analgesics like fentanyl, and followed by that general anesthesia will be given, isn't it? Patient will be urinary catheter will be inserted. Then patient will be inserted with the endotracheal tube, and then the patient will be placed on a mechanical ventilator. Okay. So once it is done, what they will do is they will open up the chest. Okay. They will open up the chest here. As you can see, they will be giving a median sternotomy. Okay. That is 6 to 8 inches. Okay. Thoracotomy or median sternotomy is given, which is 6 to 8 inches. This will be opened up. The chest will be opened up to get access to the heart. And usually they will be using a rib retractor, okay, to retract the ribs. Suctions also may be used. Okay. And after that, what they will do is they have to get the bypass grafts, isn't it? Usually it is done before only. They will arrange the graft and keep. Okay. So the bypass graft, as I have told, it is taken from different sites. Okay. The site is again decided on depending on the patient's condition. Usually it will be decided by the cardiologist. The choice of the graft depends on the location of blockage, or it depends upon the extent of blockage, or depends on the size of the coronary artery, patient's medical condition, and even availability of artery or veins. Okay. So remember, the graft that we are using for the blocked coronary artery are taken from the patient's own body. Okay. So either you will be going for the internal mammary artery, or we also call it as internal thoracic artery. We can also go for radial artery, which is in the arm, and commonly we go for the great saphenous vein. Okay. Other than that, sometimes we also go for inferior epigastric artery or gastroepiploic artery. But normally, commonly, which I have seen is the sites are internal mammary artery. Okay. Commonly they will decide is on the internal mammary artery because the patency is quite high. Okay. 90% it is told to be good, best one. And patency rate is for up till 10 years. Okay. That is for internal mammary artery or internal thoracic artery. Then that is in the chest. Okay. Either they will take any of these, they may take. Okay. Not all. Any of this depending on the choice of the cardiologist. Okay. Sometimes they will also take the radial artery. Radial artery patency is 5 to 6 years. Okay. And next is great saphenous veins are also selected sometimes from the legs because they are the longest veins in the legs, isn't it? So that also may be selected. Now you may think that what will happen if these veins or this artery is removed. Okay, so normally we know if these veins are removed also, the blood circulation is restored by other veins and arteries. So there is not much of complication. Okay. But it was seen that those patients whose radial artery was removed as a bypass, later there was a report of hand ischemia, pain or wound infection was reported. Okay. So that is why normally they don't prefer radial artery, but internal mammary artery is having the highest patency followed by the great saphenous vein. So that is usually preferred. Okay. And nowadays even alternative arteries are available, like Dacron grafts are also used. Okay, but I have not seen those type of surgeries till now, but these surgeries are being visualized commonly. Okay, so here you can see, isn't it, this is a saphenous vein that has been removed. Okay, they will arrange it well and then they will fix it in the region of the heart where there is blockage. So here also you can see how they have removed the vein. Okay, they have stripped the vein and they have kept it ready for the CABG surgery. Okay, so this is the same thing that is being shown. Now commonly when they are using this saphenous vein, what they will do is this saphenous vein, one end will be attached to the aorta. As you can see here in the figure, one end will be attached to the aorta and the other end will be to the narrowed or obstructed coronary artery. Okay, whenever they use a saphenous vein. Okay, so when they harvest and when the patient is when this harvesting is done, that is when you're removing this, normally what they will do is they'll be injecting heparin. Okay, so that there will not be any blood clotting and all. Okay, so they will be giving heparin. Okay, don't think that when you give heparin your a patient will be having bleeding during surgery, because they will give antidote for that also. Okay, don't worry about it, they are giving antidote for that, that is protamine. Okay, now there's a traditional CABG surgery. What they do in that is, commonly the vital organs perfused while the surgeon operates on the non-beating bloodless heart. Okay, the entire procedure that is done is on a non-beating and it is a bloodless surgery. Okay, because here the patient is placed on a CPB machine or a heart lung machine. Okay, I'll tell you what is a heart lung machine or a CPB machine. So um, this heart lung machine is a machine that is functioning like a heart also, like a lung also, during the entire CABG procedure. And this heart lung machine will be operated by a person that is an perfusionist. Okay, he will maintain and see whether the entire vital organs will receive enough oxygen supply. Okay, and since this blood is going into the heart lung machine, chances are there that blood clots will be formed. So what they will do is, during the procedure they will be giving heparin to the patient. Okay, they will be giving heparin to the patient to prevent the clotting, and after the surgery, to reverse the effect of the heparin, they will give the antidote protamine also. Okay, so remember, the CABG surgery is done on a non-beating bloodless heart. Okay, so what they will do, they are diverting the entire blood into the heart lung machine here. Okay, so this is the heart lung machine. Okay, here you can see the heart lung machine. This is how it looks. Okay, now what they will do is, initially this heart has to be stopped. Okay, for that they will be usually injecting a very cooled iced salt water. Okay, they will be injecting into the heart. You need not write all this for the exam. Okay, I'm just telling it for your knowledge. So initially what they will do, they have to stop the metabolism, or they have to reduce the workload on the heart. Okay, and what will be done, the heart will be connected to the heart lung machine, isn't it? So for that they will cool the heart with the iced saline solution. Okay, and they will inject the saline solution into the heart's artery. Normal it will be 4 degree. Okay, 4 degrees Celsius. Why it is done? To reduce the myocardium metabolism, and also it is done to reduce the workload on the heart, and it will minimize the damage to the heart during the time of the surgery. Okay, so that procedure is called as cardioplegia. Okay, cardioplegia means what? The procedure of injecting the iced saline solution into the heart. Okay, that is called cardioplegia. Okay, so cardioplegia is nothing but, you can tell that it is intentional temporary stopping the card's activity, isn't it? Okay, so what they will do, once they slowly stop the heart's activity, they will be connecting this patient to the heart lung machine. Okay, so patient's right atrium, that will be connected to the blood reservoir, then it will go to the filter. Okay, then it will go to the filter. So in the after that it will go to the oxygenator, where it will remove the carbon dioxide, and next it will go into the heat exchanger, where already I told temperature was reduced, isn't it? So you have to warm up the blood little. So they will that heat exchanger will maintain the temperature for 28 to 32 degree. Okay, that is done by the heart lung machine here. Okay, next once it is done, it will go to the reservoir, then into the pump, and then into the then again into the filter, and then through the femoral artery it will go into the body, where the entire vital organs will receive the oxygenated blood. So that is a function of the heart lung machine. You need not remember all these things, that is not necessary for you. Okay, just for the knowledge I told, because you will be confused how it is connected, what happens there. Okay, so remember, during this CABG procedure, the entire functions will be done by the heart lung machine, or CPB machine, cardiopulmonary bypass machine. Okay, so this machine, what they will do is, through the patient from the right atrium, they will connect to the heart lung machine. Okay, from the right atrium of the patient, it will go to the heart lung machine. First it will go to the filter, then oxygenator, heat exchanger, okay, and then to reservoir, pump and filter. Okay, and then it will reach back to the patient through the femoral artery. So all the vital organs will receive oxygenated blood. Okay, so that much you have to remember. Heart lung machine functions as heart also, as a lungs also. Okay, so this figure you can draw. Here you can see the distal end of the left internal mammary artery is grafted below the area of blockage. You can see this is the blockage, and here you can see that left internal mammary artery, that is actually also called as internal thoracic artery. It is having the highest patency. Okay, so that is placed here. Okay, it is placed here. Okay, and in one more end you can see they have placed the saphenous vein. So saphenous vein, when they are using, they will use it on one side of the aorta, and one more side it will be used in the area of the blockage. Okay, so this figure can be drawn. Now after the surgery, what they will do is, they will disconnect the heart lung machine, and they will restart the heart. Okay, they will restart the heart. Then after that, what they will do is, they will place the chest tubes, because a lot of blood and air will be there. You have to drain all that, isn't it? So chest tubes will be placed in the mediastinum and the pleural space to drain all the remaining blood. Okay, so after that, what they will do, the sternum will be wired and the incision will be sutured closely. Okay, so that much will be done, and then this is how the patient looks after recovery. Okay, and one more thing is, patient will be placed on a temporary pacemaker. Okay, until he recovers, they may be placed on temporary pacemaker, and usually the patient may be on ventilator for some time also. So here you can see chest tubes are being connected, isn't it, to drain the excess of blood or air. And patient will be moved into the ICU or ICCU. After the surgery, the patient will be moved to the ICU or ICCU to recover. So for recovery and to recover from general anesthesia, it will take time. So until that, the patient will be kept in the recovery unit. After the person is slightly stabilized, they will move the patient to the cardiac surgery ward. Now, what are the complications of the CABG surgery? Since it is an open heart surgery, or since it is a major surgery, why it is a major surgery? Because the entire surgery will take around 3 to 6 hours. Okay, that is to open up and even to close. Okay, it will take 3 to 6 hours, and as I told, the cost is 1 to 5 lakhs. Okay, the complications of CABG surgery is, sometimes if you are not maintaining the hygiene, if it is not done in an aseptic technique, it may result in infection. And sometimes patient can have excessive bleeding or blood clot, that is hematoma can be there. While doing the surgery, there can be injury to the nerves, pain may be there. Some patients may suffer with stroke during the surgery or afterwards also, because of the blood clot or thrombus. Some patients may develop MI after the surgery. It's very common. It's very much seen that patients develop arrhythmias and MI after the CABG surgery if adequate care or adequate monitoring is not done. Okay, and sometimes what happens is, when the infection develops, there will be lot of accumulation of fluids in the layer of the hearts. Okay, so that is called as cardiac tamponade or pericardial effusion. That is also one of the major complications. And sometimes if fluid and electrolytes are not maintained, there can be imbalance, hyponatremia, hypokalemia and all can happen. And sometimes patient can go into hypothermia in the post-operative ward, or some patients can go into hypotension or shock, some patients into hypertension, and even death can happen. But nowadays, since this is a very common surgery and most of the surgeries are told to be very quite successful. Okay, now what is the post-operative care that you have to do for CABG patient? First of all, as soon as the patient is coming out of the recovery room, you have to monitor the vital signs continuously every 10 minutes, every 15 minutes, half an hour, hourly also. ECG will be monitored. Patient will be on the cardiac monitor. Okay, kept on a cardiac monitor. Ventilator may be there until he recovers. ABG will be done continuously. Arterial blood gas analysis. They will also monitor the oxygen saturation. Then next is you have to maintain airway patency. Okay, like if person is on ET tube, they may have to do regular suctioning also. Okay, then continuous bedside monitoring with the cardiac monitor. Then see that the drains from the chest are not kinked, it is not obstructed. Okay, and also assess the level of pain of the patient, and you can give analgesics. Remember, the patient will be kept on, will be given antibiotics, okay, to prevent infection. And the ICU nurse has to assess the site of the surgery. Okay, surgical site has to be examined to see whether there is any signs of infection. Here there is complete recovery. Okay, this is the only the what we can tell, only the surgical incision you can see here. Person has already recovered well here. Okay, now other than that, you have to also assess the extremity which was which you have removed for bypass, isn't it? Maybe radial artery was used or saphenous vein was used. So that area you have to check whether there is adequate healing, whether there is adequate circulation, edema is there. That everything you have to check, even the bypass graft site. Next is monitor for complications, especially for low BP or decreased cardiac output or signs and symptoms of shock. And monitor the intake output of the patient, because patient may be on IV fluids. After the person has recovered and once he is in the cardiac ward, what you have to do is encourage early ambulation. Let the person slightly sit on the bed, relax. Okay, after that you can teach the person to walk a little, give active and passive exercises also. And always provide a cardiac diet for the patient. Okay, and cardiac rehabilitation is very essential. Now this cardiac rehabilitation topic I will take separately. Okay, next is emotional support should be given to the patient and family, because they will be usually very anxious. So give emotional support and also teach deep breathing and coughing exercises, okay, so that there is no respiratory complications or cardiac complications. And after complete recovery, usually person will be on this NG tube. Okay, once they have not given IV fluids, they may be on NG tube. Now once they are planning for discharge, everything is all right with the patient, what you have to do is you have to teach the patient certain things when he is planning to get discharged. Okay, and also tell the patient that they have to identify complications. How they will identify complications? For that, you have to give health education regarding all the disease conditions, regarding lifestyle modification, how to monitor the pulse for 1 minute. That everything the patient has to learn and go home. Okay, and also monitor for monitor the surgical site. Next is also tell them they should not do driving for 4 to 6 weeks after the surgery, not to walk or climb this like they can climb the stairs, and walking is a good exercise. Okay, that you have to tell initially only, it is not advised. Next is they can do mild moderate exercise but not heavy exercises, and light household chores can be done. Tell them not to use hot tubs because there is incision site, it has to be healed. They should avoid sexual intercourse for 4 to 6 weeks after the surgery. Avoid traveling, okay, for 2 to 4 weeks, and avoid crowds and all. And not to exercise in too cold or very hot environment, that can trigger heart attack. They should not lift heavy objects, and they should avoid any sort of injury to the chest, and they should come for a frequent follow-up. Okay, so this is about the traditional CABG surgery. Remaining things we are going to discuss it again.